Hello, my name is Bailey Bishop. This is my presentation on the effect of wearable medical technology data on information governance. Introduction. Wearable technology has evolved since the 1950s from portable radios and wristwatches. One of the earliest wearable medical devices was a wearable heart monitor. This is the Holter monitor. Modern wearable devices can track things like heart rate, blood pressure, blood glucose, and many more things. They can all do this remotely. There are challenges concerning the security and privacy of patient data affecting the adoption of wearable medical devices. Accuracy concerns can impact decisions physicians make when trying to treat their patients. Additionally, the original Holter monitor was around 85 pounds. Purpose of the study. The purpose of the study is to review and examine existing research on wearable medical technology. When researching, examine the impact the following has on patient data. We want to research the management, the use, and collection. The advancement of technology has increased the adoption of wearable devices. Wearable medical devices are impacting how patient data is analyzed, transferred, and created. Research question. The question concerning this research study that I conducted was, how does wearable technology or health monitoring technology impact the management, use, and collection of patients' data in healthcare? What's the importance of this question? Wearable medical devices are becoming more prevalent in gathering data to help treat patients. Understanding how this data is collected and used by health informatics professionals can help physicians in clinical decision-making. It is also important to understand challenges that may occur as the amount of data keeps increasing. What's the significance of this study? This study examines how data gathered from wearable medical devices impact health information management. There can be positive and negative effects that data can have on patient care. Health informatics professionals can help ensure data is accurate and reliable by monitoring it. Physicians can then use this data in clinical decision making and helping improve patient care. Research methodology. There were several routes I can take when researching my question. I could either have chose the qualitative or quantitative research method, and I chose the qualitative research method. The sources that I used for this study as part of the qualitative research method was government studies, journal articles, and other sources. All of these sources were chosen because they contain information on how wearable medical devices can collect and manage the use of data. These sources also contain information on what wearable medical devices are, as well as accuracy, privacy, and security challenges that come with these devices. My findings and analysis. The findings focus on wearable technology and its impact on the management, use, and collection of patient data. The analyses that were made were based on different studies and articles. These were the important topics that I found concerning the research question that I made. These important topics were data accuracy and the privacy and security concerns regarding patient data. All of the findings made are essential in understanding challenges and concerns of these topics. What are wearable medical devices? These devices are typically worn on the body to track a patient's health. These devices also help support healthcare professionals in treating their patients. Now, what are the types of wearable devices? There are typically two types of wearable devices. These are consumer devices and medical devices. Consumer devices are typically devices you can buy on your own, like fitness trackers and smartwatches. These devices usually track your physical activity, heart rate, and sleep. Now, medical devices are devices that are often prescribed by your doctor and can be used in clinical use. These devices have more advanced functionality and can track your vital signs, your symptoms, and irregularities in your health. There can be external and internal devices. External devices can be things like smartwatches or biometric clothing. Internal devices can be things like biointegrated implant sensors. Data accuracy of wearable devices. Data accuracy is critical because it is used in clinical decision support. Wearable devices can be inaccurate. This is often due to sensors not being calibrated correctly or the sensors malfunctioning. Accuracy problems can cause overdetection and underdetection. Overdetection can be false alerts or false diagnosis. Underdetection can cause delayed care and misdiagnosis. Consumer devices could be considered medically inaccurate and not suitable for clinical use. Accuracy of wearable devices and its reliability depend on the quality, calibration, and the validation of data. Privacy and security challenges of wearable devices. Wearable devices are important continuous monitoring, warning sign detection, and treating patients. Data storage and the transmission of it can raise ethical concerns of privacy and security. Now, there are some regulation concerns with wearable medical devices. Not all wearable medical devices are covered under HIPAA because they may not be covered entities. If the device is not a covered entity, they are regulated by the FDA or FTC. Sharing data also has its risk. Sharing data has risk when shared to third-party companies and researchers. These concerns are often about hacking or unauthorized use of patient data. Transparency and informed consent concerning data is important because patients need to know how their data is being used. Analysis of research findings. Wearable medical devices can monitor a patient's heart rate, oxygen levels, blood sugar, blood pressure, and more depending on the device. Wearable medical devices continuously collect data and can alert when something abnormal is detected so physicians can treat their patients in a more timely manner. Concerns with data accuracy. These concerns are overdetection and underdetection, which I mentioned previously. These can cause delays in care, misdiagnoses, and false alerts, which can very negatively affect a patient if their physician treats them incorrectly due to overdetection or underdetection. Data privacy and security concerns are also things I found during my analysis. The risk involved with these things are when transmitting data to cloud and remote servers. These risks are often hackers due to poor security when data is transmitted. Conclusion. This study was conducted based on the question, how does wearable technology or health monitoring technology impact the management, use, and collection of a patient's data in healthcare? What are the significant findings that I found during my research? These significant findings are that accurate data gathered from wearable medical devices can help healthcare professionals in clinical decision-making and improving patient care. I also found that properly securing data transmission and storage is important in protecting patient privacy. Because if it's not protected well, then there are opportunities for hackers to breach and steal data, which can negatively affect the patient. Overall, the data collected from wearable medical devices can help improve patient care, but it is dependent on the accuracy of the data collected and how it is used in clinical decision support. What are my recommendations for future research? My first recommendation is to evaluate the data accuracy standards for wearable medical devices. Ensuring data accuracy is important because it affects the care patients receive. If data is not accurate, physicians can often misdiagnose a patient or prescribe them wrong medications, and that can affect a patient's health negatively. Research needs to focus on identifying what standards decide the accuracy of data collected by wearable medical devices. My next and final recommendation for future research is researching the standards that could lead to better standardization. It's important to evaluate the impact data collected by wearable medical devices that has on the integration of data into electronic health records. It's important to research how interoperability standards affect wearable medical devices. Better interoperability between wearable devices and electronic health records can help with sharing between physicians so they can coordinate their patients' care. These are all the references I used for this presentation and my entire research paper. Now I open up to any questions. If you have any about this presentation, or if you have any comments about the presentation or the information in it, please let me know. I'm happy to answer anything. And this was my presentation. I hope you enjoy. Thank you very much for watching.